Today's broadcast from the Health Lounge is about NADH and chronic fatigue syndrome. And with us directly from Vienna is Professor George Birkmayer, who discovered the therapeutic effect of NADH. Hello, Mr. Birkmayer. A very good day to you, Ms. Renneberg. You are the discoverer, inventor of NADH, the therapeutic effect of NADH. So what is NADH? NADH is the biological form of hydrogen. The more of it the cells in our body have, the more energy they produce, allowing them to live longer and function more efficiently. However, in order to give our body more of this natural fuel for cellular energy production, it needs to be administered in a specially stabilized form. Professor George Birkmayer has succeeded in doing this as a result of decades of research. The Austrian scientist is regarded as a leading international expert in NADH. The effect of his NADH formulation has been proven in numerous studies, and the researcher enjoys a worldwide reputation in oncology, neurology, and anti-aging medicine, with his guest professorships and lecturing activities in North America, Europe, and Asia. And what is chronic fatigue syndrome? Chronic fatigue syndrome, or CFS, is a chronic illness characterized by severe physical and mental exhaustion as the main symptom. And despite the unexplained cause of the emergence mechanism, chronic fatigue syndrome is an internationally recognized condition, according to the Centers for Disease Control. We originally thought it was an orphan disease, with only a few people suffering from it. But the Centers for Disease Control have unambiguously classified chronic fatigue as an illness with the code G93.3. And the symptoms of chronic fatigue are lack of concentration, memory problems, painful lymph nodes, unexplained muscle weakness, muscle pain, depression and forgetfulness. And importantly, these symptoms must be prevalent, i.e., present for at least 6 weeks to meet the definition of chronic fatigue. However, it must be emphasized that there are many diseases for which these symptoms are also characteristic, such as cancer, heart failure, immunodeficiency, rheumatism, arthritis, or other organ damage. And all these diseases must therefore be ruled out before a final diagnosis of chronic fatigue can be made. It's also important to note that more than 100 million people around the world suffer from chronic fatigue, and that many accidents are caused by chronic fatigue syndrome. In other words, major disasters have been shown to be the result of fatigue. The costs of these disasters run into the billions, and the question is, if you had an energy-boosting tablet that would fix this chronic fatigue, you could certainly greatly reduce the damage done. Chronic fatigue is always due to exhaustion and a lack of energy in most cells, and where we need the most energy, in the heart, brain, and muscles. Some researchers in the USA have used a special computed tomography method to show that patients with chronic fatigue have an ATP deficit in their muscles. This explains the severe fatigue and muscle weakness described by the patients. Also interesting are the results of Professor Mikorova of the Riordan Clinic in Kansas, who has proved that the NADH concentration in patients with chronic fatigue is 20% lower than in healthy people of the same age. So I can correct the NADH deficit with a tablet, increase the level of NADH, so to speak. The answer is yes. That's possible, and we've demonstrated this in a study of isolated heart cells. We mixed the isolated heart cells with NADH and were then able to detect and prove an increase in the concentration of ATP, i.e., the energy store of the cells. And the cells with NADH live twice as long as those without NADH, which means that purely on the basis of this experiment, NADH could be declared as a life-prolonging substance. However, in order to carry out studies on humans, we had to convert this NADH powder into a stable, orally absorbed tablet, which was easier said than done. After more than 4 years of research, we have succeeded in producing NADH in a tablet that is stable for more than 2 years and meets the requirements for a medicine. And with this patented formulation, we conducted an FDA-approved, placebo-controlled, double-blind study at Georgetown University in Washington, D.C. This showed that 72% of patients had an improvement in their symptoms, which means they are less tired and therefore have no complaints in this regard. So 3/4 of patients were helped with NADH. If I may ask, on average, can you say how long it takes to recover from chronic fatigue syndrome? How long on average does a patient have to take NADH? That's a good question. We used only 10 milligrams of NADH per patient in this study and conducted it over a period of 6 months. This means that 3/4 of the patients improved or returned to health after 6 months. And today, we know that the 10 milligrams of NADH is far too low a dose. We recommend patients with chronic fatigue to take 80 to 100 milligrams of NADH, which is 4 to 5 NADH tablets of 20 milligrams each. You can read more on this topic in my book, NADH, the Biological Hydrogen, The Secret of Our Life Energy. I've brought along the book for you here. When was it published? This is already the second edition. The first was published in 2013, and the second edition came out last year. Without wishing to sound vain, may I also say that it has been translated into English, Russian, as well as Chinese. So NADH against chronic fatigue syndrome. Yes, it works. Try it out. Thank you very much for talking to me today. I wish you all the best and stay healthy. Thank you. The same to you. Thanks.